Health links is a principle basically surrounding a person with all sectors of care needed to support that person in their daily life. And everything from health to social services can be involved at the table. Coming up with a coordinated care plan together so that all members of the care team are knowledgeable and understanding of what the person's care needs are, and ultimately what their goals are to help them achieve what they need for their health and their social life. This is done using a coordinated care plan to ensure that all members of the care team understand what the patient's goals are and who needs to do what to help that patient meet their goals ultimately. So the coordinated care plan is updated regularly. The entire care team can provide CCAC with updates that need to be placed in that coordinated care plan, and then the coordinated care plan is then shared out with the entire care team, so everyone is kept up to date with the patient's care needs and goals, medications they take, and all the contact information needed of the entire care team, and that is available to everyone that has access to ClinicalConnect. So ultimately, health links is a concept of enveloping care around a person. And in order to do that, we really need a tool that's able to share that information with the entire care team. And what we have available to us right now is ClinicalConnect. And what ClinicalConnect does is allow us to virtually in real time share a person's coordinated care plan with the entire care team that does have access to ClinicalConnect. So people from primary care to CCAC and hospital all have access to ClinicalConnect, and ultimately they can view a person's coordinated care plan. So at CCAC we input notes constantly, and with those notes and service plans, a lot of times physicians, primary care, really want that information up to date right away. What the benefit of this is they can see it at any time, any place with an access to a computer. So ultimately, any update that CCAC puts in a patient's chart is shared automatically, and the primary care physician is able to see what those updates are. The other benefit of this is when a patient goes to hospital, the emergency room sees the real-time notes and information as well. So the entire care team potentially has access to the patient's information needed to properly care for that patient while in hospital or at primary care. And the benefit of having ClinicalConnect is, let's say they do go to the emergency room in London and they are from Owen Sound. Those ER physicians and nurses are able to see right there their coordinated care plan, the patient's coordinated care plan, and understand what they need to do to help that patient meet their goals.
We have to understand that these people with high care needs are on a journey in the system, and a lot of them have high care needs and complex issues, and so their situation, their health status, their plan needs to adapt over time, and so the coordinated care plan needs to be flexible with them, and we need to be able to share any changes in a timely way with the entire team, and ClinicalConnect really facilitates that timely sharing of updates to the plan and what the needs of the person are. I think that one of the key benefits of ClinicalConnect and being able to share the coordinated care plan on that platform is really the benefit to the patient. So if we have a bunch of people wrapping around a person, a client, a patient, in order to better coordinate their care, we all need to be on the same page, and ClinicalConnect helps us do that. You know, how better to care for people than to be really well informed about what's going on for them.